today's video, I'm going to be talking about a new physiotherapy device that we have at our office that we are extremely excited about. This is our new shockwave machine. Shockwave is also referred to as ESWT, or extracorporeal shockwave therapy. It emits acoustic sound waves into tissues that has a variety of healing effects at the cellular level. Some of these effects include decreased pain, decreased inflammation, and what's really cool about the shockwave unit is that it actually has some regenerative effects as well. This means that it also stimulates collagen synthesis in our joints to help with joint lubrication and padding. It also can result in stem cell proliferation, which really helps regenerate and heal tissues from a cellular level. A lot of physiotherapy devices, help with the pain, help with the inflammation, but what's really cool about the shockwave is that we also get some of those regenerative effects as well. Shockwave therapy is very effective for a variety of orthopedic conditions. Where I think it really shines is with our tendinopathies. This includes Achilles tendinopathies, plantar fasciitis, golfer's elbow, tennis elbow, bicep tendinitis, rotator cuff tears, rotator cuff tendinopathies. These kind of conditions where we're dealing with tendinous or ligamentous type tissue really respond well to shockwave therapies. The reason for this is that tendons are white if you look at them under a microscope versus a muscle belly, which is red if you look at it under a microscope. This means that the tendon, which is white, does not get as much blood flow typically as a muscle belly does. Because of this, healing times are typically much longer for these tendon type injuries, which a lot of people deal with. There's a direct correlation between how much blood flow a tissue gets and how quickly it responds to treatment and how quickly it recovers from injury. This is the shockwave head or transmitter that we use to transmit the shockwaves into the tissues. As you can see, there are a variety of different heads that we can use. They just screw on and screw off like this, and each head really comes with a different penetration depth and penetration intensity. Because of this, it's really important that a skilled practitioner is the one that's performing the shockwave treatments, because a really strong understanding of functional anatomy is important to make sure we're actually treating the tissues that we're looking to treat. A typical shockwave treatment can last anywhere from about 5 minutes to 15 minutes, and that really depends on the patient's tolerance. When we do a shockwave treatment plan, we're usually in kind of the 4 visit to 10 visit range. How quickly someone responds to the shockwave visit depends on a variety of factors. Most commonly, patients who are insulin resistant or deal with blood sugar issues, that tends to damage our tendons, and the shockwave treatments take a little bit longer to heal the tissue. Also, patients that smoke typically respond a little bit slower to shockwave. With shockwave treatments, there's not a lot of tissue discomfort. We're usually operating in a 3 to 4, sometimes a 5 out of 10 pain scale when we are doing the shockwave treatments. Overall, it's not a very painful treatment. One thing that's really important to note with shockwave treatments is that you're going to feel a lot better after one of the treatments, and you're going to want to go out, you're going to want to get out there, you're going to start running again, running sprints, you're going to want to get back to pickleball, whatever it is that you love. But it's really important to note that when we do these shockwave treatments on, say, a tendinopathy, that there is a little bit of a transient weakening of that tendon because we kind of beat it up a little bit with the shockwave treatments, meaning that it's a little bit more susceptible to a more serious injury, to a more serious tear potentially. So we got to make sure we back off our activity for the first 3 or 4 shockwave treatments to make sure we don't injure ourselves further. That being said, that decrease in pain that you're going to experience means that we can progress through our physical therapy exercises at a faster clip. So we can start loading those tendons, typically in the eccentric fashion, a lot sooner when we are doing our shockwave treatments, because you're going to be in less pain. Overall, our healing times are going to be a lot faster when we're incorporating shockwave therapy into the other therapies we perform at our office, including our chiropractic care, other soft tissue therapies. Nutrition is extremely important when we're treating tendinopathies, and we'll often put people on things like collagen and tendinous support type supplements, anti-inflammatories like fish oil, quercetin, proteolytic enzymes, bromelain, papain, all these things can help accentuate the treatment benefits of the shockwave and help you getting back to doing the things that you love faster. If you'd like to learn more about shockwave, you can reach out to us via email, on our website, via phone call. We'd be happy to let you know more about how shockwave can affect and positively influence your specific condition. All right, that's all I have for today. If you have any comments, you can leave it in the comments section on here, and we'll be sure to get back to you and answer any questions you might have about our shockwave therapy. Thank you.